Perineal care prevents skin breakdown of the private area of the patient, itching, burning, odor, and infection. It is important to maintain client comfort. Hi sir, good morning. My name is Christy C. Castellon, student nurse from USPF. So for today sir, I will going to do a perineal care. Is it okay with you sir? So sir, may I know what is your name? Okay sir. So before that sir, I will first get my materials and wash my hands. So before putting all the linens, I will place a towel to protect my linens. Then my waterproof pad, mittens, then my basin, and the soap. So before I will going to start, I will first wear my gloves. So in doing the perineal care for male, I will first going to lower the blanket or fold the blanket below to the penis of the patient and put under the penis of the patient a cloth to avoid the bed from soaking from the water. Then I will going to cover the chest of the patient to provide privacy, and after doing that I will going to get my mittens. Then put this to the water. Then after putting it to the water, I will going to squeeze it and make a mittens like this. So we have the back side, the middle, the side, and the side. So for example, this is the penis of the patient. Then I will going to raise the penis of the patient, and if the patient is uncircumcised, I will going to retract the foreskin of the patient like this. Then I will going to start from the urethral of the patient. So like this in a circular motion outward. Then I will going to do to the shaft of the patient. Then I will going to use the other side of my mittens, this one. Then in a one stroke, one stroke, one stroke, and one stroke. Then I will after rinsing the penis of the patient, I will going pat dry. I will going to pat dry Then we will going first to make a mittens to pat dry the penis of the patient. Then we're going to pat dry it first at the urethra of the patient from outward also. Then to the shaft. Then we'll go in washing or rinsing the patient's scrotum. We will going to instruct the patient to slightly widen their legs to the scrotum of the patient for you to clean it properly. Of the patient's penis, I will going to lift the scrotum, then wash the skin fold in a circular motion like this, then use the other one like this, then use the other one like this. Then after washing the scrotum and the skin fold of the patient, I will going to rinse my mittens. Then rinse the scrotum of the patient. Then we will going to use other mittens. Then to pat dry the scrotum like this. Then after pat drying the patient's penis, I will going to position the patient at a comfortable position, and ask the patient if he is comfortable with that position, and I will going to clean all the the materials that I've used, and all the mittens and linens that I've used to the patient. I will going to put that in the hamper. After performing the procedure to the patient, I will going to get my waterproof pad under the patient's shoulder or under the patient's body, and I will instruct the patient to side lie at the side by my assistance, and fold the waterproof pad and put that into the hamper.